I'm Carl Shallahorn with the Debunking Addiction blog on HealthyPlace.com. Today I'm going to talk to you a little bit about co-occurring disorders. They're also known as dual diagnosis. Basically, what it means is it's someone who has both an addiction problem as well as a mental illness. And it's actually more common than what you might think. For instance, 39% of people who are alcohol abusers also have a mental illness issue. And 53% of individuals who are drug abusers also live with at least one mental illness. So as you see, it's pretty common. Not only that, but 29% of people who live with mental illness also abuse at least one drug or alcohol. So people with co-occurring disorders historically have been more difficult to treat than those who have only one or the other disorder. And there's a lot of reasons for that. There's medication noncompliance and things that come into play, self-medication. All these things are what people deal with who have a co-occurring disorder. So one thing to consider is the type of treatment that a person can receive with a co-occurring disorder. And one of the types of treatment rather that's been found most effective is integrated treatment. And what we mean by integrated treatment is that we're taking both types of treatment, addiction and mental health, and putting it into one synthesized treatment method in one setting. In the program where I work, we have integrated treatment where we have groups for individuals dealing with both mental illness and addiction. And we find that by doing that, it's more effective than just treating one method or the other. Now, one thing that's key when it comes to dealing with a co-occurring disorder and for an individual who wants to find their way out of the addiction problem is, you need to minimize, if not abstain completely from the drug abuse or the alcohol abuse. It's been found rather through research that individuals who stop using drugs and alcohol and approach their treatment that way for their mental health issues have a greater rate of recovery. For me, for instance, for years I was in a situation where I was abusing drugs and alcohol. I was also having mental health problems. I have a diagnosis of bipolar disorder, so it was something that I was really having a hard time grasping in terms of how to find recovery. Once I stopped using drugs, once I stopped using alcohol, things got considerably easier for me. It didn't make it totally easy. It wasn't like I just, it was a walk in the park, but for the most part, it was more manageable, I should put it that way. So if you're dealing with an issue of co-occurring disorders, the final thing I would recommend is that you never give up hope. It is so important that you believe that you can do this. And it might take time, but you have to be patient and you have to know that by following the proper steps, you can get this under control. So remember, abstinence is one of the first things you want to try to manage. If you need help with that, there's programs, actual formal clinical programs. There's also Dual Diagnosis Anonymous or Double Trouble if you have those in your area. There are places where you can get that kind of assistance, or there may be even other kind of support groups where you live that address both these issues at the same time. So don't give up, always keep the faith, and stay hopeful. For the Debunking Addiction blog on HealthyPlace.com, I'm Carl Shallahorn.